All right, we're going to begin with immunologic disorders, and we're going to talk a little bit about HIV and AIDS. You're going to get really in depth into HIV/AIDS next year, but we're going to talk a bit about it now. It is a retrovirus that is passed by blood and body fluids. Okay, children who have HIV frequently that's acquired perinatally. It can be transmitted from mother to child. The pathophysiology, that virus infects the CD4 T cells, and those cells become non-functional and actually are converted to become virus factories. So they replicate the virus. CD4 lymphocyte count gradually decreases, and that leads to immunodeficiency. In children, the initial HIV infection, so this is a long disease process. And as treatments have gotten better, it's become more chronic and less of a continually progressing fatal disease. That was when AIDS originally appeared. It was a continually progressing fatal disease. Now it's become more chronic and management is better. But the initial infection can have some symptoms. They may be mild. Okay, so with the initial HIV infection, that child may have lymphadenopathy, so they have enlarged lymph nodes. Hepatosplenomegaly, the liver and spleen are enlarged, oral thrush, candidiasis, chronic or recurrent diarrhea, failure to thrive, developmental delays, or parotitis, inflammation of the parotid glands. Now, HIV infection is not the same thing as AIDS. AIDS, the disease, has specific defining characteristics. So when someone who is infected with HIV, for them to have a diagnosis of AIDS, they have to have specific infections, and the staging of that infection is based on CD4 counts. Okay, so ELISA and Western blot identify the antibodies, and that's going to determine whether if the patient has the infection. However, if there was prenatal exposure, the first 18 months of life, that child may have maternal antibodies, and so the test may not be accurate. And then testing is done. CD4 counts are used to determine staging, and then AIDS diagnosis depends on CD4 count and on specific types of infections. Management, antiretrovirals are given to slow the growth of the virus, and there are a lot of meds that are used for HIV. You don't need to learn the specific meds. You need to know that the goal is to slow the progression. They may be given to exposed infants because we can't wait to start treating until we find out for sure if it's mother's antibodies or babies that allows the disease to progress too much. And so they may be given to exposed infants. They're often given in combinations to prevent resistance. So that's one thing, antiretrovirals. And then we need to prevent and treat opportunistic infections. So the most common pneumonia is pneumocystic carinii pneumonia, PCP. Exposed infants are treated prophylactically until HIV infection is ruled out. Prophylactic antibiotics, antifungals, and antivirals are used to prevent systemic infection for anyone who has HIV. IVIG can be used to prevent recurrent bacterial infection. So if they have, they've gotten an infection, it keeps coming back, then they can use IVIG to prevent that. Immunizations need to be given, but live immunizations should not be given to anyone who has severe immunocompromise. So the stage of the disease is going to determine whether live vaccines can be given. And that patient needs to have precautions against infection at all times, especially if their counts are low. The symptoms need to be treated. Pain management. The disease itself causes some pain because of those chronic or recurring infections. The treatments cause pain, and then the testing. So we need to be managing the pain for those kids. We also, all of the meds that help AIDS have side effects that are, and adverse effects that are painful and uncomfortable. And so we may be helping manage side effects of meds. And nausea, vomiting, diarrhea, and anorexia are common in AIDS. Nutritional support, failure to thrive is very common, so they may need nutritional support. And then we want to prevent transmission. A child with HIV infection or with AIDS can attend school and daycare. Standard precautions should be used for any body fluid in any facility. So that's less controversial than it was when AIDS first came out. They've tried to bar children with HIV and AIDS from attending school. But now this is why we have universal precautions or standard precautions, is because that movement began with, or really got strong with, HIV. So any body fluid that comes out of a person, we need to handle it with when you use standard precautions. We also may be in the position to give emotional support. Family members, friends, or community members may be afraid, or they may ostracize that child or the family. We may be helping the family determine when is the best time to disclose the diagnosis to the child. If a parent is infected, they may need support in making future plans for childcare. The family has to deal with the potential loss of a family member. There are often financial difficulties. The medications are expensive, and the disease makes it difficult to work consistently. And then we need to help those families educate school personnel. And then they may need assistance in dealing with, or referral to some resources to deal with either the possibility of dying or living with this disease long term. Also, confidentiality is a major issue because there's still a lot of discrimination. Prognosis is better than it used to be with adequate treatment. People can live with HIV for quite a while.